David. I have your blood work back, so I want to go over all your tests. This is our traditional Joy Wellness Partners hormonal panel. We also add some tests for you, like lipid panel, some homocysteine, some add-on tests to dive deeper into your health. So I like to start here with this big panel. It's called Complete Blood Count. So this is the panel that checks quality of your blood. So we look at the different cells in your blood, like white blood cells, for example. They're fighters, they fight infection, inflammation. We want to make sure you didn't go through an infection when we draw your blood. You weren't fighting any COVID or flu. So like you see the number, it's normal, which means your immune system weren't fighting anything. Just want to show you real quick the next panel. It's called Automated Differential. And that one dive deeper into different type of white blood cells and their ratio towards each other to just dive deeper into your whole immune system, to making sure everything is in balance there. So like you see, all the numbers look totally fine. So that's perfect. Good immune system. Other cells in your blood are your red blood cells. Red blood cells are the cells that carry hemoglobin. It's a very important protein because every time you breathe, your hemoglobin attaches to oxygen and delivers it to all the cells in your body, and also nutrients and all of that. So you have really good number of red blood cells. A size of your red blood cells also within normal limits. The same is with hemoglobin. Number of your hemoglobin and size and concentration of your hemoglobin is all normal. Hematocrit will tell us the percentage of hemoglobin in the blood, making sure you have enough, and that is also within normal limits. And the spaces between your cells are also within normal limits. So all of those tests, perfect. Those is basically, we call it anemia panel, because if you're low, that means you're anemic. You know, anemic people tend to be pale and weak just because there's not enough oxygen going to all the cells. So this is all perfect. Another cells in your blood are platelets. Platelets are the healing molecules. Every time you cut yourself, they go patch out any wounds and have a lot of growth factors on them. So you have a really great number of platelets and also good size of your platelets, which is perfect because we're about to do PRP today. We want to make sure you have enough platelets so we can extract from your blood and inject back in your body. Then we have another big panel called General Chemistry, and this panel tells us how your kidney and liver function.
How was that?
That looks great. So first, kidneys. Kidneys, B1 and creatinine, those are typical tests that tell us how your kidney function. We want to see them on the lower side, and they both within normal limits. Also GFR, it's a kidney test, tells us filtration rate of your kidney. We want to see it more than 60, and yours is 82. All your electrolytes like sodium, potassium, chloride, calcium are within normal limits. You're not retaining carbon dioxide, which is the gas we're breathing out when we're breathing oxygen. People with sleep apnea or stay indoor all day or snore very often retain a lot of CO2. Your protein status like tall protein, albumin, and globulin, all of those proteins are within normal limits, so it means you're not malnourished. And then we have your liver enzymes. So we have 4 of them: bilirubin, alkaline phosphatase, ALT, and SAT. Out of all 4 liver enzymes, one is slightly elevated. We will work on that. I think that kind of correlates to the lipid panel we check, and that kind of correlates to your diabetes test. Sometimes when people have slightly pre-diabetes or diabetes, all that extra glucose goes to your liver and it's converted to triglycerides. So very often we have this something called non-alcoholic fatty liver disease, when liver just gets a little bit too much fat cells. That happens because of our modern diet. You know, it's full of glucose, simple sugars. So we can work on it with the diet, and we also can put you on some milk thistle to nicely help you clear your liver. LD, it's lactate dehydrogenase. So it's an enzyme that it's released in your body when something is rapidly growing, breaking up tissue. This is like a cancer screen, because if something in our age grows rapidly, it's never a good thing. We want to see it less than 300, and yours is nice and low, within normal limits. So that panel looks good. A couple things to work if it comes to your liver. And now we have your hemoglobin A1C. So this test, it's like a summary of your sugar level in the last 3 to 4 months. It's a diabetes test. It's the percentage of that hemoglobin protein coded in sugar. So this is where we have to work on. It's 6.0, which puts you in a pre-diabetic state. So like I said, it's mostly we want to clear it by implementing good diet. The most important is what you put in your mouth first thing in the morning. When you wake up and you eat food rich of fiber, the fiber will coat your GI tract and prevent that sugar being absorbed too fast. Because when you eat like oatmeal for breakfast or cereal, they spike your sugar and put you in like inflammatory state for the rest of your day. And no matter what you eat, you're gonna have inflamed and high glucose, inflamed body and high glucose. So that's how we can do. Start with the fiber. Definitely not snacking between meals, because our pancreas produces insulin based on what we eat. So when we eat meal, it produces insulin. Insulin grabs that glucose and put it inside the cells for energy. That's our gas, you know, for our engines.
Right.
However, when we snack and eat between meals, our pancreas cannot produce enough that insulin. So very often that leads to diabetes. Also, if we're eating too much of simple sugar, that insulin takes the glucose and put inside the cells too much, and the cells grow like balloon and can burst. So to protect themselves, cells close those gates, you know, close this balloon entry. So then it's called insulin resistant, when your cells are resistant to that insulin bringing glucose, and high insulin leads to weight gain and all of that. So we'll work on it if it comes to diet. Then we have some your vitamin status, like your whole anemia panel when it comes to iron. So your iron level, it's good, it's within normal limit. Your total iron binding capacity is actually high. So it's like the capacity, how much iron can bind to cells. Your iron saturation, however, it's within normal limits. And your ferritin, which is stored active form of your iron, it's only 14. So for men, we want to say around 100. So it looks like you have a lot of iron and iron binding capacity, but not enough to store good iron. So we can work on it by also implementing healthy diet. This could also be high because of the inflammation too. Iron, it's better absorbed if it's taken with vitamin C. So if you eat iron-rich food like red meat, keep in mind to always add some vitamin C to it, like lemon water, citruses, stuff like that. No juices though.
Okay.
Your vitamin B12, it says it's elevated. However, B12, it's water-soluble vitamin. So if you have too much in your system, you just pee it out. But if you're supplementing with B12, we can definitely reduce that dose.
Take shots.
Yeah, take shots. Yeah, so maybe not as often, like once a month.
Okay.
Then we have your whole coronary risk panel, which has all your fats. So this is triglycerides. So triglycerides are elevated, and triglycerides are never from eating, like they say, cholesterol-rich food. Triglycerides are pure glucose. If you eat too much sugar, that glucose molecule goes to your liver and gets converted to triglycerides. So this is not from eating eggs, this is not from eating meat, this is purely from sugar or processed food. So we'll work on it with diet. Your total cholesterol is 255. That one, the same, we can address by reducing glucose and simple sugar in your diet. And also we need to work on increasing your good cholesterol called HDL, because it's only 35 and we want to see it more than 40. So that's where a good fats play part, very important part. So we want to increase good quality fish consumption. Avocado, it's a good fat. I think you may benefit from doing high dose of omega-3 fatty acids, because sometimes we're not getting enough from fish, and a lot of fish has a lot of mercury, so it's always good to add that supplement. Omega-3 fatty acids are like nature's aspirin, so to prevent blood clots. So that can also help, you know, prevent blood clot formation in your blood. And LDL are those considered like bad cholesterol that's also elevated, and that's how we want to work on it. So it's a really nice combo. You will take it with meals, and we'll work on those numbers to drop them down. And the ratio of your cholesterol to HDL, it's of course elevated too, because not enough good fats, too much bad fats. CRP cardio, this is inflammatory marker of your vessels and your heart. I know they wanted less than 3. We ideally wanted less than 1, because when you have inflammation in your vessels, that leads to vessel damage. And when your vessels inside are already damaged, anything can stick to it. So let's say somebody has a high cholesterol, but no inflammation. The cholesterol won't stick to the arterial wall. But if you have already arterial wall inflammation and very little cholesterol, even that little cholesterol can stick to it. Next test, it's homocysteine. Homocysteine is also another cardiovascular marker. So when people have elevated homocysteine is very damaging to vessels. Some people naturally have it high. Why? Because of MTHFR gene mutation. When people have mutation of that gene, they cannot convert some of the Bs, and they cannot use the B vitamins and metal donors to clear that homocysteine fat better and faster from their system. Ideally, I want to see your homocysteine around 7, not 12. That can really elevated can really have a damaging effect on your vessels, in the failure lining of your vessels. This is another like a deep dive into your lipid panel. Lipoprotein A, it's a really bad protein. That one wraps around cholesterol and it's so damaging to vessels. Every time you have an elevated lipoprotein A, basically goes and sticks to arteries. Unfortunately, that one, it's like a genetic marker. People have it elevated because of genetic issues, so they really cannot do much about it. Thankfully, that's not you. Yours is only 14. So your elevated lipids are mostly due to diet, not necessarily due to genetic component.
Cool.
Apolipoprotein A, it's like this good protein that wraps around cholesterol and lipid molecules, and that one actually helps you clear out your endothelial layers and help you clear out the bad cholesterol like atherosclerosis. And apolipoprotein B, it's opposite. It's the bad one, wraps around the fat molecules, and it's very sticky. When it goes through your vessels, sticks so easily to arteries. So those are both within normal limits, so that's good. You know, this is the worst guys. This is the bad guys. So if you have elevated cholesterol and elevated ApoB, I probably will start some more aggressive treatment to lower your lipids. Your vitamin D is beautiful. For functional medicine, we want it between 70 and 100. Yeah, some good news. 70 and 100. Vitamin D, it's like a hormone, takes part in all the processes in your body. I know you're probably taking it. Vitamin D, because it's fat-soluble vitamin, it can be dangerous in a high amounts because we don't clear fat-soluble vitamins as easily as we clear our water-soluble vitamins. So definitely you don't want to overdose on that one. And vitamin D can drop your vitamin A. So it's good to take them in a combo, but maybe every other day rather than daily. Then we have your thyroid. Your thyroid actually looks good. So first, in your brain, you have this little gland called pituitary gland, and pituitary gland produces TSH, and that stands for thyroid stimulating hormone. So like the name says, it goes and stimulates your thyroid. So I don't want that stimulation more than 2. I actually aim it between 0.3 and 2, so you're within normal limits, because I don't want your brain to overwork for that thyroid. And then your thyroid produces active T3 and inactive T4. T4 is considered inactive because it doesn't do that much in our body. In a cells, has to convert to T3 outside of thyroid. So I want that active T3 to be more than 3, and you're within normal limits. And active T4 I want more than 1, and you are within normal limits as well. So good thyroid functioning. Thyroid peroxidase antibodies, those are like antibodies that some people produce and they just go and attack the thyroid gland and destroy it. That's called autoimmune condition. It's called Hashimoto. You have only 35 of them, which basically clears you don't have a Hashimoto. Yay. And then we have your PSA. PSA, it's prostate-specific antigen. It's like a molecule that's released from your prostate when the prostate grows. So it not always means prostate cancer, sometimes means prostate enlargement. Yours is really nice and low, 0.9. We want to see it below 4. So that clears us for hormone replacement therapy. So now we come to your sex hormones, more exciting part. So first we have LH. LH is luteinizing hormone produced in our brain, and goes to your testes and make your testes produce more sperm count and more testosterone. For you, LH is slightly suppressed. It's because you are on testosterone replacement therapy, which can suppress your LH. It's not a big deal because at certain age, men choose not to reproduce anymore. So that LH production, it's not necessarily something that will affect you. But there are peptides that can increase it if you're ever interested in still expanding your family. So I just want to tell you that there are options. Your estrogen, it's 13. For men, we kind of want it between 20 to 60, but we don't replace estrogen for men. Estrogen is very important for collagen production, so your skin, your joint need estrogen. Also, it's a mood stabilizer. Very low estrogen can mean depression. However, very high estrogen can make you very moody and irritable. So we really want to have it like between 20 to 60.
That's what the gym is doing.
That's what the dim is doing, exactly.
So if mine's low, do I have less dim?
Yes, so I think at the beginning, right after pellets, you can take more dim, and as the pellets wearing off,
Right.
There's less conversion of testosterone to estrogen, so then you can drop the dim to 1 a day. DHEA is a hormone produced by adrenal glands. That one usually is high when we are young and go down with age. Your testosterone still looks great after the last pellets. Your total testosterone is 863 and your free testosterone is 16. So they're both within normal limits because, like, you know, we aim for 900 to 1200. And total free testosterone, we wanted more than 15. So that looks great. So that's if it comes to your sex hormones. And then last one, ANA. This is antinuclear antibodies. This is like a test for autoimmune conditions. It's not very specific to any
I was wondering
of them.
Turn out.
Yeah, it's negative. So it means like you don't have autoimmunity. All the autoimmune diseases have similar mechanism of action. Your body attacks certain cells. So you want to make sure. Then if that will come back positive, then we can dive deeper which one. But if it's negative, we'll just leave it like it is.
Cool.
Yeah.
Good job.
Everything makes sense?
Yeah.
Yay!
Thanks for watching. I'm Carol Joy Bender, the founder and nurse practitioner at Joy Wellness Partners. If you found this video helpful, give us a thumbs up. Please subscribe also to our channel and share this video with someone who you think could benefit from it. You can also learn more information about these services by clicking our link in the description below. You can also leave a comment to let us know what content you'd like us to put out next week. Thank you so much for being a part of our community, and stay along with us for enhancing wellness in our world. See you next week.